So as you can see, we've incorporated this as a screen versus what you're familiar with the way our forms are normally accessed so that this can remain a living document. So at the top, they will be able to set up multiple treatment plans. They can name them either by need, or I was thinking about this around 3 a.m. and was thinking they may want to do it by episode of care because each treatment plan does have the ability to have multiple needs within it. And so once you name your treatment plan, then you have the ability to initiate it. And then once you initiate, it's in progress, as mine is going to stay until either all of the goals are met or until the patient discharges. So I'm not going to click finalize at this time. We also have the ability to associate this with a primary diagnosis. And then we have archived versions available. At the top, we have a patient assessment where you have strengths, preferences, and abilities, and the question regarding have any outcome measurement tools been performed. If yes, then there's a box to indicate and to document a little bit about those. And of course, if no, then that doesn't need to have any data, additional data display. Now here you see that I do with this patient already have some needs identified. So relapse prevention, employment, PTSD, for example. I can add a need by clicking the add need button, and it says select template because each user, or each not user, but each client is able to configure preset templates. So if for a specific need they want to have specific goals, objectives, interventions populate, then they can. For now, though, I'm just going to work with the ones that I have created. So for example, relapse prevention. By clicking on this need, it's going to populate some details over to the right side, including the need name. I can click the pencil icon to edit as I need to document maybe the as evidenced by statement, answer the question whether it needs to be referred to external resources or not. Of course, select the status of this need and then associate it with an ASAM dimension if appropriate. Now, we know not all clients use ASAM, so for those that don't, this field won't even display as an option. That's able to be set up in the back end. Jennifer, did you raise your hand?
I did not.
Oh, okay. I may have just seen motion, so sorry. Making sure. As I scroll down, you'll see that there's a signature option out to the right of this section individually. So staff can sign as they go, as can the patient. So when I click sign, I can either apply a staff signature or a patient signature using a 4-digit PIN. We do have the participation statement included for patient signatures. And then as I scroll down, because I'm on a specific need, as I scroll down, you're going to see a goal that is related to that need. And I'll know additionally without scrolling up that it's related to that need because I'm going to see a tree begin to build here with the arrow in between letting me know which need I'm on and which goal is being, or which need the goal is associated with, I should say. Same thing, you can edit as you go. You can also sign as you go if you need to, and you can add comments. Then I have some objectives for that particular need. Again, my tree develops further. Now, one thing that will be added is, and I'd like your input on this, is a target date field within the objective. I'd like to know in a few minutes whether that's the appropriate area for that to be in versus maybe the goal or intervention. But for now, we are planning on adding the target date within the objective area. We do have the new section for progress or lack of progress towards an objective. And then, and of course, as I click on a different objective, it's going to populate that additional data. And then as I scroll down, it's going to display an intervention or multiple if they would like regarding that particular objective. My tree develops further. And then within this section, I have the ability to not only update the intervention name, but the date that it was resolved, the frequency, the amount and frequency, clinical process. We have so far group, individual, family, medical, psychiatric, and other. So for example, with this one being the individual writing a detailed drug history and sharing in group, we indicated that it might be an individual and group process. And then we have a status for this particular intervention. Okay, so I can update as I go. And of course, I can sign as I go. So this can be printed off at any time to be given to a patient. You can choose to print the entire treatment plan if you would like to. You can also, maybe you just want to print a couple of objectives that they're working on or a couple, something like that. Then you can print only those areas that you would like for the client to focus on for the time being.